These are the stories of sandwiched pre-physical eyes. This is the story of one-eyed carpenter who had progressive loss of vision with every episode of pain and redness over last 2 years. Slit lamp examination showed signs of healed uveitis with 360 degrees posterior synecdoche and complicated cataract in a soft eye. These can reveal inferior retinal detachment with decreased axial length and increased CRT suggestive of early phthisis. Our dilemma was whether it was chronic uveitis leading to retinal detachment or was it retinal detachment which led to atrophic uveitis with complicated cataract. We decided to give a benefit of surgery in this eye, declared legally blind elsewhere. Viscosyncolysis being done. Iris hooks placed to dilate the pupil. Phacoaspiration of this relatively soft cataract was done. Primary posterior capsulotomy done. Vitrectomy being done. You can note the old shallow retinal detachment. After staining with brilliant blue, ileum was peeled under fluid. PHCL put a radial retinal fold emanating from the disc nasally and intake in the fibrous capsule at pars plana in superior nasal quadrant was total. To our surprise, during tissue dissection, trapped foreign body was liberated, which was never suspected pre-operative. Foreign body was picked up with vitreous forceps. Under viscoelastic was delivered through pre-existing phaco wound. Further dissection of residual fibrous tissue was done to look for the remnant of foreign body and also to relieve the traction on radial retinal fold. After relieving all the traction, fluid air exchange was done. Endolaser was done to all the braids. Silicone oil was used as a tamponade. At 6 weeks, patient recovered 6/36. Similarly, when you feel you have conquered, there is always a next bigger challenge staring at a VR surgeon. Here comes another challenge. This one-eyed female had a loss of vision following episodes of pain and redness over last 3 years. Slit lamp examination revealed disc folds and early band-shaped keratopathy, 360-degree posterior synecdoche with total complicated cataract. These can show disorganized glow with significantly decreased axial length and increased CRT. After viscosyncolysis, ionisic hooks used to further dilate the pupil. After CCC, phacoaspiration to this relatively soft cataract was done. The consistency of the vitreous was unusually opaque and thick. We can see hemorrhages beneath the fibrous tissue over posterior pole. Pre-retinal and subhyoid heat was removed with Charles Brook needle. The proliferation over the posterior pole was peeled with membrane peeling forceps, which came out easily. The base excision revealed severe fibrous proliferation over pars plana and ciliary body, all 360 degrees, which was dissected meticulously using forceps and vitreous cutter. Probably, this proliferation was the reason for ciliary shutdown and phthisis-like picture. fluid air exchange dam. Further peripheral membranes peel. PFCL put to drain the posteriorly trapped fluid. Drainage retinotomy done. Nasal to the disc, silicone oil tamponade done. At 6 weeks, patient regained vision of 2/60. Small wooden foreign bodies cannot be picked up by NCRA investigations, especially when they are in the vicinity of pores. Encapsulated foreign bodies can cause chronic recalcitrant uveitis. Relief of fibrous proliferation over ciliary body region can lead to revival of hypotony in the early thumbsicle eyes.